do worry that these tests are being rolled out too quickly, too prematurely, and without adequate oversight, that we are going to have unintended consequences.
Well, for weeks now, we've told you about the push to get at-home COVID-19 testing kits to the market, but are they safe and reliable? There is concern out there tonight. Those kits, along with antibody testing, has been fast-tracked from development into use. 11 Investigates' Aaron Martin getting answers tonight on how much scrutiny these tests are getting before they're approved.
The FDA has authorized more than 200 companies and healthcare systems to do diagnostic testing for the coronavirus, including Allegheny Health Network, where they're using a drive-up site here in the north side. They've also begun authorizing antibody testing throughout the U.S. But 11 Investigates has learned that's raising red flags for some medical professionals who are concerned about how fast these tests are being authorized. UPMC has been a leader in the fight against the coronavirus pandemic, developing one of the first diagnostics tests in Western Pennsylvania and showing promising results in the development of a vaccine. But the healthcare system is still developing its own antibody test, which determines if a person has the right protective protein to fight off the coronavirus.
It's up to each health system, each laboratory, to determine the parameters and interpretation of that assay.
Dr. Alan Wells is the medical director for UPMC's clinical laboratories. He expects UPMC will complete the evaluation of its antibody test in the next few weeks, but Wells is concerned about tests already on the market.
Many of us do worry that these tests are being rolled out too quickly, too prematurely, and without adequate oversight, that we are going to have unintended consequences.
Consequences like a false positive antibody test, making someone incorrectly believe they are immune to the coronavirus. The FDA wanted to get results to the public quicker and move them through the approval process using emergency use authorization. The trade-off is the FDA is not independently verifying that data. In a release from April 18th, FDA Commissioner Stephen Hahn said regulations on antibody tests were relaxed to give laboratories and healthcare providers, quote, early access to these tests with the understanding that the FDA has not reviewed or authorized or approved them, at least not initially, and these tests should not be used for diagnosing or excluding active SARS-CoV-19 infection.
If the test kits aren't safe, if they're not reliable, if they're not giving us good data, then they can do more harm than good.
Congressman Mike Doyle told 11 Investigates the FDA commissioner recently met with members of Congress to discuss concerns over testing availability and accuracy. While understanding the difficult position the FDA is in, Doyle is uneasy about the unknowns surrounding testing.
Everybody needs to take these kinds of tests with a grain of salt until we get further validation and have further studies on it.
What those studies show could also have a direct impact on how quickly Pennsylvania reopens its economy, decisions that will be made with diagnostic test results.
The number of cases there are, the number of people who are still at risk, that's how we make decisions. And so it's even more important at the population level to have accurate data.
Duquesne University professor Allison Colbert specializes in public health. She says 100% accuracy for diagnostic testing isn't necessary when it comes to treating patients, since there's no coronavirus therapy or cure. However, accurate test results are now more critical as governors decide when it's safe to reopen.
Ultimately, the quality of those decisions is directly dependent on the quality of those data.
Now, Governor Tom Wolf says he's going to use data and his medical experts in determining when it's safe for portions of Pennsylvania to reopen. As for the FDA, they pointed us to information on their website, but did not respond to our request for an interview. Reporting tonight in the North Side, Aaron Martin, Channel 11 News.